Miss
Morning.
Morgan. I'll be your nurse. How are you doing?
Okay. How are you?
I'm well. Can I just see your wristband to verify your name and date of birth?
Sure. It's Lana Degree 12873.
Yep. And your MR number matches here. Alright. And do you have any known allergies, whether that be drug, contact, environmental, medication,
No.
food?
No.
Alright, I see here that there's no known allergies on our side as well.
Okay.
And do you have any pain right now? Are you experiencing any pain on a scale of 0 to 10, 0 being no pain, 10 being the worst?
A 3.
A 3? Okay, where's that pain located?
Around my chest.
Around the chest, like the center, or is it off center?
Kind of around both sides.
Okay, and then when did that pain start?
Ever since I came in the hospital.
Ever since you came. Okay, does anything make it better or worse?
It's worse when I cough.
Okay, and does it go anywhere else? Does it radiate, or is it just the chest area?
To my back a little bit.
To your back a little bit? Okay.
Yeah. Mm-hmm.
All right, and is there anything coming up when you cough? Is it productive?
It is productive.
It is, okay.
Yes.
And how would you describe the mucus? Is it clear?
Yellow,
Yellowish? Okay, is it thick?
Thick, yes.
Okay.
It's gross. Mm-hmm.
It's gross. And would you say there's a lot or just a little every time you cough?
Yeah, it's almost every time, and it's a good amount.
Okay. Does anything make the pain or the coughing better or worse?
Sometimes the medication helps a little bit.
Okay. Yeah. So the yellow color, that's probably because you have an infection.
Okay.
So that's a sign of just a sign of infection.
Okay.
So that should hopefully go away since we did discontinue the antibiotics today, but we'll keep an eye on that.
Okay.
It's probably just clearing it all out. But
Okay.
you do have a chest x-ray later today just to reevaluate, and we do have plans to discharge since you are going to be off antibiotics, hopefully. So I'm just going to do an assessment on you if that's okay, and
Yeah.
see where you're at.
Okay.
Alright, so I'm just going to listen first. I'm going to listen to the sides as well here.
Okay.
Right, and I'm going to listen to the back as well.
Okay.
I'm just going to sit you up here a little bit. I don't hear anything.
No. It's okay. Is it clear, or you don't hear anything?
I don't, like there's no sound.
Okay.
Yeah, I don't hear anything in the back.
No. Okay.
They do sound pretty clear to me, actually. We go ahead and take your heart rate now. Oh, and I do hear some wheezing.
Okay. Good. I can hear it. Seems
Yeah, 76.
Okay.
Alright, I'm gonna take your heart rate, or your temperature, and your pulse ox to see how oxygenated you are.
Great.
Is this actually gonna read?
No, I will tell you.
Okay. Okay, and just under the tongue here.
It's 36.5 degrees Celsius.
Okay.
Oh, I thought you did it already. Sorry.
All good.
36.5.
36.5.
Mm-hmm.
So 97.7.
Okay, great. She's 95
95.
on room on.
One room air. Awesome. Oops. Okay, I'm gonna take your blood pressure as well. Actually, I'm gonna listen to you one more time.
Okay.
Okay, so I got 12
Okay.
respirations. It's a little low, but still okay. And then blood pressure.
Okay. Just press harder. What you can feel for the pulse.
Okay.
And when you put your stethoscope, just press a little bit. Do you feel it?
Oh yeah, I do.
Okay.
That's so weird. How cool. Got 115 over 60.
Okay.
This is a little low as well. Okay. All right. Ms. Sigri, have you been using this incentive spirometer at all?
A little bit.
A little bit? When's the last time you used it?
Oh, last night.
Okay. And do you know how to use it?
I'm not
Feel
sure
comfortable
if I'm
with
doing
it?
right, actually.
Okay. So basically you just want to monitor how high this one goes, and your goal is to get it higher. So the higher you're getting it, the better. Basically you're just gonna take a normal breath out and then suck in like you're sucking a straw. And the goal is to get the little thingy, the little lever up.
Okay.
So if you want to try now, you can.
Okay.
But you really want to try and do that every hour or every 2 hours, and it's going to go home with you. So you can do it at home. It really helps. And also I noticed that you have a nicotine patch, which is great because smoking 1 pack a day actually increases your risk for infection, and it's probably linked to how you got the pneumonia in the first place.
Okay.
So it's really important to, try and discontinue if you can and keep using the nicotine patch. Try the gums. We definitely have resources here and people you can talk to about that. But smoking increases your risk for infections and worsens the infections, makes it harder to heal from them. So
Okay.
just so you do know that.
Okay.
And we do have some meds for you today.
Okay.
So we have benzonatate, which is for a cough suppressant, so that's going to help your cough.
Okay.
And with this one, you do want to be careful to swallow it. Don't chew it or suck on it because it numbs that area,
Okay.
and that'll worsen the side effects. But and then we also have the Protonix, which is for like acid reflux and can help with the cough a little bit as well, and that can cause diarrhea and headache.
Oh.
So if that starts, you do want to let a doctor or me know.
Okay.
And if you have to get up or go to the bathroom or anything, since some of the meds that you've been on can cause dizziness and headaches, just please call me so I can assist you and help you out. Because we don't want you to fall, make everything worse. But yeah, I can get those meds for you now.
Okay.
Any questions so far?
No.
Okay.
Here.
Then I'll be right back.
Here. Here, I got it for you.
Oh.
Sorry.
Alright. So again, this is the cough suppressant, the benzonatate. And just making sure it matches. Expiration's good.
We're checking it against which?
Checking it against the MAR, so it's
Okay.
100 milligrams.
It should be
Yeah.
on your computer.
Oh,
Yeah, yeah. Just give it a minute.
oh,
Yeah.
see, I didn't know if it
Okay, yeah.
sorry.
That's okay.
Yeah, so the benzonatate, 100 milligrams PO,
Okay.
3 times a day.
Okay.
And then the Protonix, which is also by mouth, which doesn't have the amount here.
It's Protonix, the pan drop.
It doesn't say the milligram amount. I don't know if someone accidentally deleted it.
Oh, really? Oh, it should be 40.
Okay, so 40.
Oh, it doesn't say it on there.
Yeah, it didn't say it
Oh,
on
sorry.
there.
Okay.
So 40 milligrams, it matches as well. And again, some of these can cause headache, diarrhea, so just look out for those. Do you want some
What
water?
Did you check for expiration at all?
Yes, the expiration on
Okay.
those are both good. And water. Here's a water cup for you.
Okay. Yep.
Here you go. Your assistance, got it. Okay, yay. Alright. Do you have any other questions about those meds?
No.
Okay. And we want you to be drinking a lot of water, especially because you were on antibiotics, so that can, or since you were on pain meds and antibiotics, those can cause constipation. So we want you to be drinking lots of fluids and also clear out all those secretions, and you're continuing to cough up that mucus. So hopefully the fluids will break that up better and help so it's clear.
Okay. Thank you.
You're welcome. Do you have any other questions for me?
No.
No? Okay. Yeah. All right, so if you need me, call bell's going to be right here for you. And I'll be back in the next, within an hour.
Okay.
So, and then I'll come get you also whenever you go down for the chest x-ray.
Okay. Thank you.
If you need to get up or if you need anything, just call me.
Okay, thanks.
No problem.
So how did you feel about this simulation versus your